Hello and welcome to Unwind Sessions, where right after my shift I give the highlights of my workday and answer any questions that might have been asked at a previous session. My name is Juan. I'm an English-Spanish medical video remote consecutive interpreter with over 4 years of experience, and today is Thursday, July 22nd, 2021. And before I get into my unwind sessions, I want to take a little moment to tell you about my day yesterday. And yeah, if you saw yesterday's video, you saw how my phone actually died on me in the middle of recording a session, and I had to wait a while, like half an hour, before actually being able to finish that video. So that just delayed everything else because I had an engagement after that I had to go to, and I couldn't upload my video right away. And then when I came back from what I had to do, I came back and then my video editing software just gave out on me. It had been giving me trouble for some time since I own a fossil computer. And what I mean by a fossil computer is a computer from 2014, a high-end one that was actually preserved through time. It was brand new when I got it in the box when I bought it last August. So it was pretty cheap, and it was good because I just wanted it for school, because one of my main computer was making a strange noise and I thought it was going to die on me. So I bought that one just as a backup, and it's working very good. But I'm having problems with the video editing software. I never thought I would use it for that, but that's all that I have. So anyways, it crashed on me, and I was looking to get another software, and I installed the other software and it crashed on me. My computer just couldn't handle it at all, so I had to look for another video editing software. And then by the time I already found it and I started rendering the yesterday's video, it was already like 12 midnight. Like by that time I was already sleeping. I wanted to go to sleep, but I knew that I had to get the video and it was my purpose. So I was half asleep. I just let the video rendering and I went to sleep, and I thought I'm gonna wake up after it renders, but if I don't, then I'll just upload it in the morning. So it turns out that for some weird reason, like I just happened to wake up and the video was done rendering. So I uploaded it on YouTube, and then I said I'm just gonna leave it uploading, and when I wake up I'm gonna finish uploading it. I'll put the computer away and then I'll go back to sleep, or if not, I'll just do it in the morning. And it just so happens that I woke up again and then it was done uploading, so I just put everything away and then I went back to sleep. And I usually wake up like at 7:30 or 8, but I have some things to do today in the morning, so I put my alarm at 7 in the morning, and I actually woke up at 6:45. So my internal clock was on point. Like everything that I needed to get done after sleeping for a set period of time, I was getting it done. So that was very surprising. That had never happened before, and I just wanted to let you guys know that happened. I was very surprised. I feel like a total programmable robot, right? You can just program me, put me to sleep, and I'll wake up right on time. So that was just wonderful. I just had to share that with you. So I'm sorry if you didn't want to hear that. So let's get back to the unwind sessions. And today I took a total of 34 sessions. Like always, it's a mix between video and audio sessions, always video sessions. That's my job, right? Video remote interpreter. So I can't complain about that. And there were several long sessions today. There was a session where I was on hold for about a half an hour, so that's always good. And another session where I was on there for about an hour. And then there was like a couple of long sessions, less than an hour though. But yeah, there were some pretty long sessions, and they always make the day go by much faster, so they are always welcome. As far as highlights for today, there was only one, and this I want to share this with you because this is something that This is the first time that I ever had to do this, and it was a speech therapy session, and they were talking to a child. I don't know how old the child was, but he was learning to talk, I guess, or he was small. Like, I never even got to see the child, only saw a little guy's hand, so he couldn't speak. Like, he was blabbering and stuff. He was laughing, very, very joyful little child, and so he didn't speak or anything, and I couldn't see his age. But what the speech therapist asked me to do is that while she was talking to the child, she had me interpret everything she said to the child. And usually what the speech therapists do is that, I mean, they're in the US, right? And they have to learn English, and they're getting like almost everything in English. Probably they're just only getting Spanish in their home, but like TV and everything else, I'm pretty sure is in English. So I understand why they do it, and they just speak English to the child. And then the mother like just tells them everything in English as well. But this time the speech therapist had me actually go ahead and interpret everything that she was saying to the child, like every little thing, like even good job or whatever. She even had me interpret peekaboo, which I totally did not know what to say for that. And I looked it up in Lingui, but thankfully the mother of the child rescued me, and she said, oh, well, you can actually say aquí estoy, which it would translate to English to here I am. And the doctor said, okay, that works, and make sure you use that and you don't use anything else when you play that game with him. And she said, yeah, not a problem. So the mom rescued me, and so for peekaboo, it can be peekaboo. For peekaboo, it can be what did it say? Aquí estoy. So now you know a good on-the-spot translation for peekaboo, right? And the provider was nice enough to tell me, do you think that translates? And I was like, I don't know, ma'am. I'm gonna have to look it up. But thankfully the mother rescued me. So yeah, that was a highlight, that something I had never had to do, translate for a speech therapist speaking to a little kid, a little child who didn't even speak. So that was something new. All right, and now moving on, the reason why you are here: 10 must-know diagnostic tests and medical procedures. And I know that there are some pending questions that I have to answer for some of you guys, but I am a little behind on my homework, and I really want to go ahead and do it today. So probably I'll answer a question tomorrow. But today I'm just gonna be doing the 10 must-know diagnostic tests and medical procedures, because I don't have that much time, and my homework's killing me. So the definitions for today come from medlineplus.gov, mayoclinic.org, hopkinsmedicine.org, nhs.uk, medicalnewstoday.com, johnhopkinsmedicine.org, and webmd.com. So let's get started. Vocabulary word or medical term, actually, number one is ultrasound. And I have already talked about ultrasound in the other videos. And the definition to ultrasound is: an ultrasound is an imaging test that uses sound waves to create a picture, also known as a sonogram, of organs, tissues, and other structures inside the body. Unlike X-rays, ultrasounds don't use any radiation. And I am sorry, because I did not write that it's also known as a sonogram. So I'm gonna go ahead and add that right now. So you can see right here, one is ultrasound, also known as a sonogram. Now, a sonogram, or an ultrasound, you will know from pregnant women. That's why what they actually use to look inside of the baby, right? But that is not the only reason why they can use a sonogram. Like it says, they can see organs, tissues, and other structures inside of the body. And this is usually preferred because it doesn't have any radiation, right? Because if you're exposed to a lot of X-rays, you have a potential risk of developing cancer. And ultrasound does not have that risk. It is safe, and that's why they do it for babies. And what can they look at the ultrasound? They can look at the liver, and they can look at many other organs, and there are many other diagnostic things that they can see with an ultrasound. So this is like a must know for medical interpreters. And number 2, that is electrocardiogram, also known as a ECG or EKG. I'm gonna be honest with you guys, I had never heard anyone say, let's get you an ECG. I wrote it there because it was there on the medical definition, and just in case you guys hear it, you will know what it is, but I've never heard it in my life. I heard EKG or electrocardiogram. Now, an electrocardiogram records the electrical signal from your heart to check for different heart conditions. Electrodes are placed on your chest to record your heart's electrical signals, which cause your heart to beat. The signals are shown as waves on an attached computer monitor or printer, EGD. Now, EGD or printer. I'm sorry, I don't know where that EGD came from. That was not part of the definition. I know where it came from. When I was making the list, that's why it got lost. So I'm sorry, regard that. No EGD on that one. It's just to a monitor printer. And the electrocardiogram, why do they do this? As soon as a patient walks in and he says he has chest pain, and they press on his chest, and the gentleman cannot feel the pain when the chest is pressed, or the patient I should say, then most likely 9 times out of 10 they're going to do an EKG or electrocardiogram to make sure this person is not having a heart attack or having any heart related problems. So this is one of those tests that you are going to get to interpret a lot, because this is like the first line of defense when someone is having chest pain at a ER, or somebody goes into a clinic with chest pain, and they are most likely gonna go send them to the ER to get an EKG. So that was electrocardiogram. And number 3, electroencephalogram, also known as a EEG. Now, this is a test that detects abnormalities in your brain waves or in the electrical activity of your brain. During the procedure, electrodes consisting of small metal discs within thin wires are pasted onto your scalp. The electrodes detect tiny electrical charges that result from the activity of your brain cells. So why do they do this? To measure brain cells, and I've had some patients that have had this done to actually see the seizure activity in their brain. So this is a great test for those patients that are suffering seizures, and they put them on to determine if a medication is working or there's still funky waves in the brain. So this is not like all that common, but you will get to interpret this. There was another procedure that I wanted to put instead of this, but that was even less common. So this was a clear winner, electroencephalogram, EEG, which you will need to know how to interpret that. Number 4, magnetic resonance imaging, or just plain MRI. Now, an MRI is a type of scan that uses strong magnetic fields and radio waves to produce detailed images of the inside of the body. An MRI scanner is a large tube that contains powerful magnets. Now, not only are you going to need to know the definition and the translation to your target language for an MRI, but also you are going to love your first screening questionnaire for an MRI. Believe me, these are lengthy and these are full of vocabularies. We have a great practice video in our practice sessions, or on our medical consecutive interpreting practice sessions here on YouTube. Go ahead and look for that video and you will have all of the answers that you need to get through those. And if you don't, you are going to be sweating and you are going to want to cry and throw the towel through that session. But it'll only be the first time, and if you have it down the first time, then it'll be easier the rest of the time. So get on that. I'm telling you this because I had to suffer through a session without any previous experience, and it was tough. It was hard, but it was only the first time though, because of course I already had the experience and I was ready the second time, and I already know all of those terms. All right, so that was an MRI. Number 5. Now, number 5 has several different names right here: computerized tomography, CT scan, or computerized, and then I put a little arrow, axial tomography, also known as a CAT scan. Now, those are interchangeable terms to mean the very same thing. So it's up to you how you want to interpret that. CT, CAT, whatever. So a computerized tomography, CT, or computerized axial tomography, CAT scan, it combines data from several X-rays to produce a detailed image of structures inside of the body. Now, this is a lot of X-rays, and they put you in a machine, and it also looks like an MRI, but it is not really an MRI. Like, an MRI can look at tissue, like really, really detailed and stuff, and a CT scan cannot really look at tissue. It's more to look at bones, like at joints and stuff, to be able to determine if there's any abnormalities with the bones, or if there's anything going on. They also use CT scans to check for like stool in patients that are really, really constipated. So there's a lot of things that can be done with a CT scan, but it's nice to know like the difference from a CT scan to an actual X-ray, which is just like a flat 2D image, and this is like many images, like slices of images that actually looks at like a part of the body. And you can actually look up several YouTube videos and you'd be amazed. Alright, so that was a CT scan, or a CAT scan as well. And number 6, colonoscopy. Alright, now what is a colonoscopy? A colonoscopy is a test to check inside your bowels. This test can help to find what's causing your bowel symptoms. A long, thin, flexible tube with a small camera inside it is passed into your bottom. Now, this is a very common procedure, and I think it's a procedure that it's required for people over the age of 50. I think they have to get it, and then if it's good, they don't have to get it in 10 years. If it's not good, the doctor will determine if they check it every year, every 2 years, or whatever the doctor determines. But a colonoscopy is a very common test, and they usually check to screen for colon cancer. So that is a must know as well. And my personal favorite, esophagogastroduodenoscopy. I don't know if you can focus it. Is it focusing? I'm pretty sure it's focusing right there. So here it is, and that's number 7, esophagogastroduodenoscopy, also known as a EGD endoscopy or upper endoscopy. Now, those are all going to mean the very same thing, and I really love this word because honestly, to me, this is like the hardest word that you are going to come across in medical terminology. So once you know that one, you're set. There is no other harder word to remember or to pronounce that I've actually come across, that I've actually had to use to this date. So what is an EGD? An EGD is an endoscopic procedure that allows your doctor to examine your esophagus, stomach, and duodenum. That's a part of your small intestine. Now the EGD is an outpatient procedure, meaning you can go home the same day. It takes approximately 30 to 60 minutes to perform. And it's also called upper endoscopy and endoscopy. Now, why do they do this? They usually just do this if there is something wrong with the stomach and they just can't figure it out. They will actually have to put a camera in there to look at the person's GI tract, right? The upper part of the GI tract. And it is usually paired with an endoscopy, with a colonoscopy, I'm sorry. For the most part, whenever they do an endoscopy, they will also do a colonoscopy, but that is not a rule. They could also just do an endoscopy or a colonoscopy. And whenever they do an endoscopy, they could do for if there's ulcers in the stomach, if there's obstructions in the duodenum, or all kinds of stuff, just to make sure that everything is well right there inside of this person's body. So that is a very, very important test, and if you learn that one, consider yourself, what should I say? I don't know, very knowledgeable of one of the hardest words that you will ever encounter as a medical interpreter. All right, and number 8, X-ray. Now, X-rays are a type of radiation called electromagnetic waves. X-ray imaging creates pictures of the inside of your body. The images shows the part of your body in different shades of black and white. This is because different tissues absorb different amounts of radiation. Calcium in bones absorbs X-rays the most, so bones look white. Fat and other soft tissues absorb less and look gray. Air absorbs the least, so lungs look black. So an X-ray, which most of you probably already know, is like a doctor's first line of defense to look if they're not able to see something. They will most likely request an X-ray. Now an X-ray can show stuff, but most of the time they will only be looking at bones. For example, to make sure if there is a fracture, they will tell the person to go ahead and get an X-ray. Now let's say a person has a joint problem. They will have that person get an X-ray to make sure that that person doesn't have arthritis or something with the bone. And if they're not really able to see that much, but the person still has pain and they can't quite figure it out, they will go ahead and request a CT scan or a CAT scan. And if that still doesn't show anything, the last resource that they have is an MRI, which actually looks at the tissue and could see like the oh man, what are they called? Those the tendons. I almost forgot how to say tendons. So yeah, X-rays are going to be something that you are going to have to know, and you're going to have to interpret that many, many, many times. And number 9, angioplasty. No, I'm sorry, angiography. Angiography. An angioplasty is something totally different. That's an angioplasty is a plastic surgery. I'm not really sure, but it's plasty, it's surgery, like plastic surgery, and angio means vein, so it's like a procedure with the veins. I would have to look up the definition to actually be able to give you like the correct definition. I don't want to talk out of my ass, so I'm not gonna do that. Just I made a mistake right there. So an angio angiography, angiography. And angiography looks at the blood vessels do not show clearly on a normal X-ray, so a special dye needs to be injected into your blood first. Now this highlights your blood vessels, allowing your doctor to see any problems. The X-ray images created during an angiography are called angiograms. So the only thing that comes to mind for an angiography is a what are those veins called? There are some veins on the heart. Ooh, oh man, why does that happen? Well, anyways, coronary arteries. Yes. All right, I remembered. So the coronary arteries are in your heart, and sometimes they get blocked, and they have to take an angiography or an angiogram of it to be able to see which ones are blocked. And if I remember correctly, then they do an angioplasty to get those veins unblocked so that there could be some circulation. They could also put a stent, a coil, or many things to open up the veins. So yes, definitely, that's an angioplasty. I remembered. All right. It's just that I was thinking that I don't know. I'll have to make sure, but I think angioplasty is also like if they take veins like from a part of your leg and then they put them in your heart. I'll have to look that up. I'll give you guys that answer tomorrow. So stay pending on that. All right, and number 10, a biopsy. And now a biopsy is a sample of tissue taken from the body. In order to examine it more closely, a doctor should recommend a biopsy when an initial test suggests an area of tissue in the body which isn't normal. Now, yesterday we talked a little bit about a biopsy, which a pap smear is like a little bit of a biopsy, right? Because they scrape a little bit of the cervix to be able to see if they don't have the HPV virus. Another thing that they could do is they could take a little sample of a cyst. They could take a little sample of anything, and they look at it under a microscope to determine what it is. For example, in breast cancer biopsy, well, in a biopsy of a breast of possible cancer, they will take a little sample of whatever is on the breast to make sure that it's not cancer. And once they determine it is or it's not, then they will do the procedure. So a biopsy definitely a very, very important procedure in a doctor's toolkit to be able to diagnose illnesses. So that was it. That was the 10 must know diagnostic tests and medical procedures. So that is going to be pretty much it for me today. Please leave your questions in the comments and I will answer some of them on the next session. Remember, I'll be here every Monday through Friday after work. And also remember that we have a Patreon page where with as little as $1 of your support, you help motivate us and you help us create much more content, and we will give you answer to all of the medical practice videos ad free, scripts to those videos, answer sheets to the videos, vocabulary list just like the one in this video. They're like 50 words each vocabulary list, and much more content. And most importantly, you will forever win a place inside of our heart. And a shout out to all of our patrons. We love you guys, and to all of our subscribers, we also love you, show you a lot of love. So thank you so much for watching. Please like and subscribe if you liked the video and have not done so for much more content, and don't forget to share. Happy interpreting. Goodbye.